Hi, my name is Dr. Ross Hauser. I'm here with my associate Danielle Matias at the Hauser Neck Center here in Fort Myers, Florida. Danielle, you do a great job running Caring Medical Florida.
Thank you.
And we often are seeing patients who don't want to get surgery.
Right.
So they might have been told they had a hip labral tear and they don't want to get surgery. Or they go to a physical therapist and they have all these tight muscles, iliotibial band or iliopsoas, and the physical therapist isn't resolving it. And then they come to us thinking that prolotherapy might help their instability. So how would you determine whether somebody is a good candidate for prolotherapy to resolve like muscle tightness around the hip or tight iliopsoas?
Sure. So usually what you alluded to, if people have tight muscles and they go to physical therapy, if it's simply a muscle problem, we don't see them. They end up, physical therapy cures their problem. Maybe it just, they don't sit as much during the day, so those muscles aren't so tight or what have you. But when people aren't able to resolve that chronic muscle tightness, I say, okay, let's dig deeper. What are your muscles protecting? Why can't you get those muscles to turn off, or not spasm so much? And so we'll look at the hip, a lot of times. Now your hip flexors do, of course, they attach in the front of your hip, but they also do attach in your low back as well. So when someone has these tight muscles, we'll say, let's start by looking at your hip. Does it click, pop, grind? If we do certain maneuvers where we have you kind of move and rotate your hip and move it out, are you feeling like a clunking, cracking kind of sound? And then also, same thing in your low back. Is there a lot of clicking, popping, grinding? Is there a lot of looseness when I'm stressing, the ligaments in your low back? Because instability there or instability in your hip, or quite frankly both, would cause those muscles to tighten and spasm.
I was just thinking, like, if a patient went to a physical therapist and the physical therapist said, you have a tight iliopsoas, what the person could do at home is look at the origin and insertion of the muscle and then determine, are there joints around there? Because if you have joint instability, that can be the cause of why the muscle's tight. So you talked about the hip flexor. So the main hip flexor is the psoas muscle. So what joints might cause tightness of the iliopsoas muscle, for instance, and what joints would cause tightness of the iliotibial band? So the iliopsoas muscle is the front of the hip. Then the side of the hip is the iliotibial band.
So for the iliopsoas, so people will commonly say I have hip flexor tightness when they have iliopsoas tightness. So it actually does attach here at the front of the hip, but then like I had said, it kind of travels like through your body and also attaches up at several lumbar vertebrae. So again, low back instability or hip instability can cause that muscle to tighten and spasm.
Sacroiliac instability too.
Well, and even with the iliotibial band, I find that a lot because the iliotibial band will kind of span almost kind of around your low back, around that sacroiliac area, through the hip, and even to the knee. That IT band attaches at your lateral knee. So people could have instability at any of those areas causing that IT band tightness. They could also have it in all three areas, contributing to it. So we got to evaluate at minimum all three of those joints.
Yeah, so iliotibial band, it's amazing how many people, like, it's very, very tight, and then all you have them do is like go like this, and you're like, oh my gosh, like you have so much lateral knee instability, and nobody's ever addressed the knee instability, for instance, and then of course you tighten up the ligaments there, the knee instability goes away, then there's no reason for the iliotibial band to stabilize the lateral knee, and then of course the tightness of it goes away. Now, the medical term for these conditions often is snapping hip syndrome. So snapping hip syndrome, if you research it on Google or one of the search engines, you'll see that notoriously there's some muscle that's rubbing, right? So like, in other words, the iliotibial band will rub here in the greater trochanter of the hip, then the iliopsoas will rub in the front here. You could see where people would first try physical therapy because if the muscle's tight and it's rubbing. But again, we're just trying to make the point that if that doesn't resolve it, it's probably that if the hip's moving too much, then it means the greater trochanter is going to move too much, so it could obviously rub it. And then if the sacroiliac joint, for instance, is loose. This bone, the iliac crest, it could be moving too much. Then it'll start rubbing the iliopsoas. I guess we should say the pubic symphysis. I mean, in rare instances.
Might contribute to it, yeah.
But so how would you diagnose? Like, how do you diagnose what joint is loose causing iliopsoas tightness or snapping hip syndrome or tensor fasciolata or iliotibial band tightness?
So, like I said, I really, at minimum, you'd want to evaluate the low back, the hip, and the knee. So, kind of what you alluded to, is there instability there? Do they get a lot of clicking and popping and grinding when the joint is moved? Do they have excess motion of the joint when it's under stress? Especially in the knee and even oftentimes in the hip, we can see this on ultrasound. If we move it, are the ligaments so loose in the knee that the bones are moving more than they should? Do they have a lot of swelling in their hip? And when I move it under ultrasound, how does that look? And is it clicking, popping, and grinding? The low back is a little bit more limited for evaluation with ultrasound, but we can do a lot of physical exam maneuvers that stress ligaments. And if those bones are moving more than they should, and it's causing pain and so forth with patients, then we know that there's instability there.
Yeah, that's a great explanation. So, and then how often do you see people?
Usually for something like this, I would see people about once a month or once every 4 to 6 weeks. A lot of times this is a runner patient, not always. Other people can get this injury too, but especially in someone that with their goal of getting back to running, maybe even high level running or marathon running, we might want to treat these areas upward of, 4, 5, 6 times to get it to resolve.
When do you determine like they can do the elliptical or they can start jogging? Like when they're undergoing treatment, when do you decide?
As they get more stability, which we'll then of course check every time they're here, as they get more stability and they're starting to get symptom relief, then we'll kind of ease them back into exercise. Maybe on the elliptical first, depending on how unstable their joints were, or we'll say start jogging, start doing some walk jog intervals, things like that to kind of build back up their stamina before we clear them to go run.
Yeah, that's great. Well, if this applies to you, you have some clicking, popping, grinding in any of the joints, like the lower back, sacroiliac, or the hip, and you've been diagnosed with tight iliopsoas or iliotibial band or iliotibial band syndrome, and it's not resolving with the things you're doing, we'd love to assess you and see if you're a candidate for prolotherapy and the other procedures that we do here at Caring Medical.